Welcome back. Welcome back. Welcome back to science. All right, to finish this chapter 15, which is a girthy cardiovascular system, we're going to end with venous supply and some heart diseases. All right, so characteristic of venous circulation. Now, it's almost like the arterial. We still have the system of going from capillaries to venules to veins that goes to the superior and vena cava. Most of that is true. Um, but unlike the arterial, it's not as like cut and dry where it goes because there are really unnamed tributaries that are going to contribute to this. So in all, we're going to have the emptying of these into the superior and inferior vena cava. So this is an overview of these. Let's take a look at some of the specific ones. So let's take a look at head. So instead of carotid, we're going to have the jugular. This is the right internal jugular, and you can see why it's called internal jugular. It's going to be going up into the innermost regions and to the brain. We can see the external jugular and the different branches that are going to be coming off of that. We have the superior ophthalmic. We have the venous sinuses that are going to be drained from this. And we can see that there's a lot of similarities like the thyroid and lingual and maxilla, but the flow is a little bit different at the same time. Let's take a look at the upper limb and shoulder. We have a deep set of veins, the digital veins, the radial and ulnar veins, and the brachial veins. Once again, this is going from most fine to most abundant. And if we go to the thoracic area on the back wall of the abdominal cavity, you're going to get things that are near the brachiocephalic trunk, but we also have the azygos and the hemiazygos veins that are all going to be joining into the superior vena cava. So we can start with the dorsal arch. We can have the ulnar and the radial arteries, and then we're going to have the cephalic vein. Excuse me, I meant to say vein. We have the cephalic vein, and in this area, you're going to have the median cubital. This is where we're going to do blood draws through right here, median cubital. All right, here's the basalic. Here is the brachial, and here is the cephalic as well. And we're going to go, this is axillary, this is subclavian. So no surprises there. Now we're at subclavian. We can see like back axillary and basalic and brachial. But here is the brachiocephalic vein, and we have superior vena cava here. This is the left brachiocephalic. This is the right brachiocephalic, leading to the subclavian. And you can see the cephalic as well as the other named vessels. On the back wall, you can see the accessory hemizygous, hemi referring to both sides. And we have hemizygous that's going to be down. You can see a fork coming off that. How it's a little bit different. It's just the way it is. And here is the azygous that's emptying into the inferior vena cava. All right, portal veins. These are unusual. They do not transport blood directly to the heart. They filter blood first. So there's going to go through a set, and there's two different filter systems, as you would guess, and that's going to be the liver and the kidneys. And so we have the hepatic portal system and we have the renal portal system. Hepatics referring to liver and renals referring to kidney. The hepatic portal system, blood from the capillaries in the stomach, intestines, pancreas, and spleen drain into the hepatic portal vein, which transports the liver for processing, and then it is going to go through all its processing before being emptied itself into the inferior vena cava. So after passing through hepatic portal system, blood drains out of the liver through the hepatic veins and into the inferior vena cava. So this is showing a little bit of that. As our liver is here, we can see vascularization move through that hepatic portal vein as it's going there. You can also take a look at the hepatic portal system, how it's going to that. It's going to go through that and then back. And you can see the renal afferent arterioles, the same thing here with going here. Then it's going to have that mid-step process before going back. So blood from the lower limbs drain into the deep and superficial group of veins. So the deep set of veins are like from our foot, anterior, posterior tibial, popliteal, femoral, external iliac. Superficial is going to be like the veins of the foot. The small and great saphenous. The great saphenous is unique because it is our longest vessel in our body. You can see the saphenous It's like, geez, that is really long. So the naming of these, very similar, most of them, to our arterial names. All right, so these are some things that will change throughout life as you age. And aging is a part of life. It's just what is ahead of us. So this is what we have to look forward to. Cholesterol deposition in our blood vessels, narrowing coronary arteries. The heart may shrink slightly uh, or enlarge due to disease. Portion of the heart consisting of cardiac muscle declines. So an increase of the fibrous connective tissue of the heart, increase in adipose tissue of the heart valves, and left ventricle wall may thicken. You'll have increased systolic blood pressure, decreased in the resting blood pressure, heart rate. I meant to say heart rate. The lumens of the arteries are going to narrow, and they're also going to harden, leading to a vessel breaking and bleeding easier. And you're going to have a decrease in the arterial elasticity. All right, so let's look at the molecular causes of cardiovascular disease. Then we'll look at some coronary artery disease. So, environmental and hereditary factors contribute. There's a disease called Marfan syndrome. Marfan syndrome, people are typically bigger, but people that, and I'm not talking about obese, I'm talking about they're very tall, very long, spindly by description. Abraham Lincoln had Marfan syndrome. Rachmaninoff had Marfan syndrome. So this typically increases the amount of a protein called fibrillin, and fibrillin is going to weaken the wall of the aorta. So people that have Marfan syndrome have a very high rate of having an aneurysm and rupture of the aorta. And when your aorta ruptures, it is immediate death. Um, it doesn't take long for you to bleed out if you hit an aorta. All right, familiar hypertrophic cardiomyopathy. This is a myosin defect. Myosin is going to be the muscle fibers. It's going to be the protein parts of those crossheads, which are going to be pulling on the actin. Remember troponin and tropomyosin, how it's going to cause muscle contraction in the sliding filament theory. This is an inherited overgrowth of the myocardium causing abnormal myosin chain in the cardiac muscle. This can result in sudden death. All right, inherited deficiency of a myocardial enzyme that breaks down fatty acid. Your heart failure results in the inability to break down long chain fatty acids. Your heart's using a lot of this for energy. And so when the heart can't use this as an energy source, you can imagine that the heart dies. All right, another thing is familial hypocholesterolemia. This is an abnormal amount of LDL, the low density lipoproteins. This is going to have receptors in liver cells do not take up cholesterol from the blood. And so instead of taking it up from the blood, using the liver, instead, you're going to have deposition where you're going to have a depositing of this into the walls of our arteries, leading to peripheral resistance, leading to increased blood pressure, leading to higher likelihood of TIA or CVA, stroke. Coronary artery disease. This is a disease involving the deposition of that cholesterol plaque in the inner walls of the coronary arteries. Leads to obstruction of the arteries. Downstream of this, oxygen will be deficient. So, often accompanied by high serum cholesterol and hypertension. Now, when a person has this blockage, oftentimes they have angina pectoralis. And so angina pectoralis means that you have pain that's associated with this tightness of chest. So this is a contributing factor of myocardial infarctions, which we call heart attacks. So treatment for coronary artery disease is percutaneous transluminal coronary angioplasty or coronary bypass surgery to bypass the blockage altogether. All right, guys, it's been a blast going through the cardiovascular system. I look forward to seeing you guys soon. So long.